Good afternoon, ladies and gentlemen. Dr. Peter Glidden. And the headlines today, it appears as if the Duchess of Cambridge, Kate Middleton, is in the hospital suffering complications of morning sickness. Number one, what happens when you get morning sickness? Do you go to the hospital? No. Number two, why do you think Kate Middleton's in the hospital? Because, you know, her next child's going to be the King of England. So they're going to do whatever they can in order to make sure that that pregnancy is viable. It's too bad they don't know me. Too bad they don't know Dr. Wallach. Too bad they are deeply entrenched in the myth of the allopathic reductionistic pharmaceutical centrist MD. You want to know a cure for morning sickness? You get oil of ginger oil of ginger. Put a couple of drops in your belly button. Voila. Most of the time, that's all that it takes. And let's talk about it for a minute, because it's, you know, it's noteworthy. The fundamental difference between the holistic approach and the reductionistic MD approach. Remember, MDs practice reductionistic medicine. They are trained in reductionism. Reductionism argues the body is a machine. It's a machine made of parts. It has no inherent built-in wisdom, nor, integrity. That it's the doctor's job to march in with symptom-suppressive, metabolic overriding drugs in order to force the body's hand and control the biochemistry of the body, because the MD is trained to believe that they are smarter than God, smarter than nature. So, when a woman becomes pregnant, from the holistic vantage point, from the reductionistic vantage point, when a woman becomes pregnant, what's necessary is to control the metabolism of the body with hormones, with drugs, with bed rest. Make sure you eat your whole grain sandwiches, right? And then when things start to go wrong, you march in with drugs and you override the metabolism of the body and you control everything. Well, this is a fool's errand. And this is why there's so much autism now, and this is why there's so much miscarriages and children born with deformities. Here's the way the whole pregnancy thing goes from the holistic vantage point, which is the correct vantage point in this regard. The human body is endowed with a God-given intelligence. It is the presence of the soul force inside the body that keeps the body knit together and that runs the trillions of automatic, unseen metabolic processes in the body every second of every day. Your body has built-in God-given wisdom, which is imparted to the body through the presence of the soul. And what happens to the body when the body dies? When the soul leaves the body at the moment of death, the body decomposes, because the soul force is no longer there to keep it together. How does the body mature from a single-celled organism into the magnificent manifestation of you? It is the wisdom of the soul force present inside the body, which argues that life begins at conception, not at birth. That's a topic for a whole other show, isn't it? Now, of course, can we prove any of this? No. And this is why the MDs have the upper hand, because as far as the MDs are concerned, if it can't be measured, it don't exist. That's the benchmark of Newtonian reductionistic physics. You have to measure it or it doesn't exist, which makes every MD who says they love their mother a hypocrite. Because if on the one hand you're saying, we're scientists and we're only going to believe it in what we can measure, well, that's all well and good. But then on the other hand, you can't turn around and say that you love your mother or you love your wife or you love your husband or you love your kids, because you can't prove that. Can you prove that you love your mother? Prove it. Prove it. Prove it. You can't. You can't prove it. Because it is something that exists outside of normal physics. It is a metaphysical experience, as most important things are in life. You know, the whole question of life, where did we come for, what's our purpose, and where are we going? The answer to those questions are inherently, patently metaphysical. And yet we have been dumbed down by the reductionistic society to think that metaphysical stuff equals, a hippie's daydream from the 60s. Metaphysical stuff is completely looked down at. We have no conceptual understanding. Every time you say you love somebody, that's a metaphysical statement. You are asserting the metaphysical. Get a clue, read a book, pick yourself up, and stop dealing with nonsense people. Fire your MD right now. So, the human body has God-given intelligence. Now, the human body knows how to fix itself. The human body wants to fix itself because of its God-given intelligence, its inherent wisdom, the inherent wisdom of the body. So, when the body is egregiously undernutrified, it knows that it is egregiously undernutrified. When your body is running on nutrient fumes, your body knows that it's running on nutrient fumes. Your body also needs that in order to maintain a healthy, viable pregnancy, your body must be replete with the 90 essential nutrients. It knows that. It also knows it doesn't have any. So it's going to disallow you from becoming pregnant. I don't care how healthy the swimmers are. I don't care how healthy the sperm is. I don't care if your husband's Arnold Schwarzenegger back in the 70s. Doesn't matter. Because if the female's body is not nutritionally replete, the body will reject the embryo. And if by some stroke of luck, you had an orange or a glass of milk the day that you conceived, and it had just enough, just a whiskers amount of nutrition at that exact moment in time to make the pregnancy viable, you're going to miscarry. That's why there are so many miscarriages. Because people's bodies are completely undernutrified. Why are they completely undernutrified? Because we've been eating whole grains for breakfast, lunch, and dinner for the last 20 years. Because we let Kellogg and Monsanto tell us what's healthy for us. One of the worst foods anybody can eat is a whole grain, because as I have taught you on this show, whole grain consumption leads to nutrient deficiency diseases, because whole grains destroy the tissue in the intestinal tract that absorbs nutrients. Horror of horrors. One of life's greatest ironies, right? Whole grains are some of the worst foods anybody can eat. Whole grains are among the worst foods that anybody can eat. They are insidious. It is only a matter of time until those chickens come home to roost, because every time you put that whole wheat sandwich down your stomach, every time you eat that whole grain granola bar, every time you have that whole wheat pizza crust, you're damaging the tissue in your intestinal tract that absorbs nutrients. Now, there's not enough nutrients in the food anyway. Now you're unable to absorb, or your ability to absorb what little nutrition there is in the food has been significantly impeded because you listen to Monsanto. You listen to your certified clinical nutritionist who doesn't know their you-know-what from their elbow. And around we go. So, if you're lucky enough to become pregnant by some miracle, by some happenstance, by some coincidence of nutrition, as the pregnancy proceeds, if the body has the structural integrity to be able to, let's say you did have nutrient reserves, in order to maintain a minimalist pregnancy, your child's going to be born with birth defects or going to be born autistic. Because it's developing in a uterus, in a womb. The embryo is developing in a house that's got leaky roof and leaky windows, and there's no nutrition in there. That's a mixed metaphor, but you get what I'm saying. When all birth defects, from our point of view, 100% of birth defects are caused by nutrient deficiencies. And every child that's born with a birth defect, or every child that's born with autism, or every pregnancy that's been aborted, spontaneously aborted, that physician should have their license yanked, because it's the pediatrician's job to keep the woman healthy. But the pediatrician doesn't know jack about medical nutrition. All the pediatrician knows is Premarin. Let's give horse hormone. That's what we'll do. Let's give Yaz. I know, that's what we'll do. Let's give a synthetic estrogen. Oh, that's a good idea. That's a nice little crapshoot. That's what we're going to do, because that's what my professors taught me, and that's what all my colleagues do, even though it doesn't work. Oh, and let's go to the fertility clinic now. Now we're going to go to the fertility clinic when they're going to pump me full of these designer drugs. It's going to force the body's hand. It's going to make me get pregnant. And then no thought to nutrition, no anything towards medical nutrition for 9 months at all. Maybe an anemic prenatal vitamin. You got to be kidding me. You get more nutrition from burning a dollar bill and eating the ash, for goodness sake, than you do from a prenatal vitamin. You got to be kidding me. And then when you force the child's hand with fertility drugs, the kids are born with birth defects. And if you look at the statistics, the children that are born from fertility clinics have a statistically significantly much higher rate of birth defects and autism. Because the MDs don't know what the heck they're doing. They think they're smarter than God. They try to force the body's hand. If it's happening to the Duchess of Cambridge, you think you have a chance? She's got more money than God, that woman. Now, if she's completely enrolled in the medical method, and if she's going 100% the medical method, you think you have a chance to not do that? No. And this is the coming storm of Obamacare. You know, there's part of Obamacare that I like because it holds insurance companies to task and it makes them cover stuff that they're trying to get out of. They're trying to shirk their responsibilities. They're trying to game the system. Obamacare takes care of some of that, at least, takes care of more of that than's happening now. But the bad thing about Obamacare is it's all inside the medical myth. It's all inside the mediocre medical matrix that everybody is completely enrolled in. Oh, the myth of the MD. It's going to force you to buy medical insurance that gives you access to a completely ineffective, dangerous system of medicine. It is going to force you to buy insurance that gives you access to MD-directed allopathic reductionistic medicine, which not only has completely let us down as far as our health is concerned, which not only is the leading cause of bankruptcy, but it's also the leading cause of death. You've got to be kidding me. War is peace. You know, constant surveillance is liberty. And access to the deadliest system of medicine on the planet is the best health care in the world. I don't think so, ladies and gentlemen. 866-582-9933 is my number. Give me a call, why don't you? And I will drag you slowly but surely into the light of medical nutrition. I say, Chauncey, be a good fellow. Bring me some horse hormone, would you? Yes, I'd like some tea and crumpets with my horse hormones, please. Thank you very much. It's quite nice. It's a good chap. Fire your MD now, ladies and gentlemen. It's the only way. We can't fight Big Pharma. We can't fight Wall Street. You can't fight these people, but you can ignore them. So ignore them. Get on board with longevity. Take the 90 essential nutrients. Take the Mighty 90. Eliminate the 10 bad foods from your diet and secure a minimum of 20,000 ORAC antioxidant points a day, and you will be on your way towards a long and healthy life. And if you become a longevity business builder and show people our method, drag people yourself into the light of medical nutrition, you will also, in addition to becoming healthy, become very, very wealthy. And that beats a poke in the eye with a sharp stick. Rick is calling now with a question about positional vertigo. Rick, thanks for calling. You are live.
Hey, Dr. Glidden, how are you?
Good, thanks. Thanks for the call.
Yes, sir. Real quick, I kind of lay the story out. I've always been an athlete my whole life. I'm 51 now. Played college ball. Started having some problems, herniation in my neck, because, you know, I thought it was leading with your head back in those days. And then I got a couple of steroid blocks over the past couple of years. And it seemed to help a little bit. But guess what? It gave me a cataract in one of my eyes. Then I talked to Dr. Wallach, got him a glucose gel, started on the Healthy Start Pack. I went gluten-free just anyway, and I've been doing that. But I started having kind of dizzy problems, and I didn't realize what it was. So I went to the ENT, of course, and shouldn't have done that, and he gave me a antibiotic, you know, it's catch-all. So next thing you know, I come down with gastritis, and I couldn't do my Healthy Start Pack. So I treated that with probiotics, digestive enzymes, apple cider vinegar, and I've kind of come out of that now. And I had one of those, it's a maneuver where it helps with your vertigo, and it is positional vertigo. But if I can just get on track right now, I'm doing all my supplements again. I'm still on the gluten-free diet. Can you give me any other advice of what you suggest I should do?
Oh, yeah, that's easy to do. So 99 times out of 100, vertigo, whether it's positional vertigo or transient vertigo or constant vertigo, is osteoporosis of the skull. which sounds a lot worse than it is. There's little canals in the skull that the cranial nerves have to go through. Most of the nerves that innervate your body get to your body from the spinal cord, which, is covered by your backbones, right? The stuff that the chiropractor adjusts. But there are 10 or 12, I can never remember, I have a block about that. Anyway, there's a bunch of cranial nerves in your brain. And these nerves come directly off of the brain and they go to your eyes, ears, nose, mouth, and throat. But to get there, they got to go through the skull. And they got to go through little tunnels in the skull. Now, if your skull bone has all of the minerals that it needs, then that tunnel is nice and strong and has structural integrity. But if your body becomes minerally deficient, which is very easy to do, that tunnel starts to collapse. Now, remember, the body has wisdom. The body knows that the tunnel is collapsing. The body knows that if this continues, you're going to go deaf, dumb, or blind, and that ain't pretty. So the body rushes to keep the tunnel from collapsing, and it throws in their connective tissue because it's got a lot of that, and that's easy to make. So now there's connective tissue, little cross members, kind of, sort of, inside the tunnels where there shouldn't ought to be, but they're there to keep the tunnel from collapsing. Invariably, the connective tissue rubs up against the nerve and causes a problem wherever that nerve is going. So if it's a nerve that goes to your inner ear, you get vertigo. If it's the nerve that goes to your eardrum, you get ringing in the ears. If it's the nerve that goes to your eyeball, you get lazy eye. If it's a nerve that goes to your larynx, your voice box, you get chronic laryngitis. If it's the nerve that goes to your facial muscles, you get Bell's palsy, and so forth and so on. It's osteoporosis of the skull, man. It's kind of like it's like an arthritic condition. Your body has run out of the minerals that it needs in order to maintain the structural integrity of the skull bones. So you got to stop eating the 10 bad foods. You have to dial that in yesterday and take one healthy bone and joint pack per 100 pounds of body weight per month and add an extra bottle of glucogel per month to give you the dosage for one glucogel capsule for 10 pounds of body weight per day. So if you're 160 pounds, you need 16 glucogel a day. Add to that 4 bottles of Ultimate Selenium a month, and you will be well on your way to a long and healthy life. Thanks for giving me a call. Welcome back, ladies and gentlemen. 866-582-9933. That's the call-in number if you're listening to the podcast and would like live help, or if I give you advice about nutritional supplements to take and you'd like to get them at the wholesale price and get a little help about understanding how to take them. If we didn't have time to talk about it on air, that number, 855-347-3696. That's 855-347-3696. Now, we were just speaking to Rick about postural vertigo. That's, you put your head in a particular position and you start to spin, right? You get dizzy. Well, on my website, Rick, and everybody else that's listening, on my online health recovery program tab, that's at fireyourmdnow.com. If you just click on the online health recovery program tab, there's a drop-down list, and in the disease-specific information topic, I have a whole little video tutorial that I put together that walks you right through this whole process and a bunch of others. I'll give you the topics that I have pre-recorded videos about: arthritis, asthma, bronchitis, candida, congestive heart failure, chronic obstructive pulmonary disease, high blood pressure, osteopenia, osteoporosis, rheumatoid arthritis, ringing in the ears and vertigo, tendinitis, type 2 diabetes, uterine fibroids. These are all available right now for a monthly subscription of $17. You can just point and click your way to Health Information Extraordinaire, cancel the subscription at any time, do whatever you want. Knowledge is power. Get informed, folks, because, otherwise you're just going to be suffering needlessly, and then like what happened to Rick, you're going to go to the MDs, they're going to give you a treatment, it's going to cause more problems than it fixed. I mean, for goodness sake, they gave him a drug that gave him gastritis. And it had nothing to do with what was causing the postural vertigo, nothing to do with it. That's like bringing your car to an automobile mechanic and, you know, you've got every time you step on the gasoline, the engine shudders. It starts and stops, and it goes erratically, right? It's not a smooth transition. So you bring them your car with that problem, they give you 4 new tires. Well, you wouldn't accept that. That's unacceptable. But the MDs do completely juvenile, ass-backwards, ineffective treatments all the time that then cause problems, and we still give them our hard-earned money every month in the form of medical insurance premiums. Stop it, ladies and gentlemen. Cancel your comprehensive medical insurance. Buy catastrophic instead, in case you're T-boned at the intersection, God forbid. Fire your MD now. Go to my website, enroll in the online health recovery program, and educate yourself easily back into the wonderful, glorious world of holistic health. Because really, when it comes to life, you know, what do we need? We need peace, and we need health. I don't care how rich you are. Look at Steve Jobs. Died of liver cancer. Let the MDs kill him. He had more money than God, that guy. A lot of good it did him. Too bad he didn't know me. Too bad he didn't know Dr. Wallach. Too bad there wasn't a longevity representative in his gated community. Chances are he would still be alive. I believe Pat is up next. Pat's calling in with a question about a bladder infection. Thanks so much, Pat. Thanks for calling. You are live.
Hi, Dr. Glidden. My pain from the bladder infection was so bad I had to go to ER on Saturday, and the pain ranged from like 5 to 8, and they gave me a drug called Levaquin and hydrocodone for the pain. Well, the hydrocodone has caused the constipation, and I have not been able to go to the bathroom, and I want to know if I could stop the Levaquin and do kilobiotics.
Yes, the answer is yes. Now look, what state do you live in?
Texas.
All right, so in Texas, I am not licensed to practice naturopathic medicine, so in Texas I can't prescribe Levaquin. In Seattle I could, in Washington State, in the entire state of Connecticut I could. So if you were coming to me for advice in either of those states where I have prescriptive rights, I could tell you, look, you got to stop taking it. But I don't have those prescriptive rights in Texas, so I can't tell you to stop taking it. You understand what I'm saying? If it were me, I wouldn't take it, and I would do the killer biotic instead. And there's a homeopathic medicine that's almost specific for helping to negate the constipative effects of drugs. And the name of that homeopathic medicine is Nux vomica. That's N like Nancy, U, X. Second word, V like Victor, O, M like Mary, I, C, A. Nux vomica. You can get it at Whole Foods or at a health food store in either the 30C or the 200C or the 200CK strength. 200CK is the same as 200C, and that would be the preferred strength in this case. It's an over-the-counter thing, costs you about $8, $9, $10. Pick up a tube of Nux vomica, take 2 pellets 3 times a day for 2 days, and see if that doesn't eliminate the drug-induced constipation. There are also homeopathic remedies for bladder infections, but it gets a little tricky, because depending on how the bladder infection presents itself, it might warrant this homeopathic medicine or that homeopathic medicine. I could have triplets, all with identical genes, right? Identical triplets. They could all present in my office with bladder infections. They might even have given it each to the other. They've all got the same bug in their body. They've all got the same infection. However, chances are that because of life being how it is, the symptomology of their illness would present differently in each of their bodies. One person might have pain when they urinate. Their sister might have pain only at the beginning of urination. And the other triplet might only have pain at the very end of urination. One of them might have blood in the urine. The other one might have mucus in the urine. The other one might have strong horse-smelling urine, right? All of these factors come into play when determining the proper homeopathic medicine. Now, I am working furiously on my next book, which ostensibly is going to be called attempting a cure. And it's going to walk people right through, well, if you have a urinary tract infection and you've got these symptoms, give this homeopathic medicine a try. If you've got high blood pressure, here's what I would do. Here's what we do to support and promote the health of the cardiovascular system, the liver, the lungs, the skin, etc. It's a giant undertaking, but we're working on it furiously, so it'll be out in the first quarter of next year, God willing. But in the meantime, if it were me, or if you were my patient in Connecticut, where I can, in fact, prescribe drugs for this type of a thing, I would tell you to stop taking it definitely, without question, and switch to the killer biotic. Also, you want to increase the amount of protein that you're eating every day, because your immune system is made from protein. That's what it's made from. So anytime we're dealing with any type of an infection, folks, you want to increase your protein consumption. You know, if you had a broken bone, right, I'd give you more calcium, recommend you get more calcium, more minerals, because that's what the bone's made from. Well, when your immune system is stressed because of a bacterial or a viral infection or whatever, you want to eat stuff that your immune system's made from. That's kind of a no-brainer. Your immune system is made from protein, and the easiest, most affordable, and easy to digest protein is the wonderful chicken egg. So have 2, 3, 4, 5 eggs a day, soft scrambled in butter, soft boiled or poached. And if you soft boil them or poach them, put butter and salt on them when you eat them, and life is good. Thanks so much for the call, Pat. Sandra is up next. Sandra, thanks so much for calling. It's your turn with Dr. Glidden. You are live.
Did you say, are you saying Chandra?
Chandra, is that you, Chandra?
Yes. Do you remember me? I met you in Florida at the convention.
Vaguely. Remind me.
Well, Mom, I live in Memphis, and I was talking to you about getting my ND. It was at the award ceremony. I got an award for the prescription drug, the savings.
I do remember. Yeah. Thank you very much. So what did you decide?
You were saying that I didn't need to go back to get my ND, and it was a waste of time. And I'm a pharmacist, and so you said, you basically said, don't worry about going through all that. But so I didn't.
All right, so you took my advice. Good girl.
Oh, well, but I do have some questions. I'm still working as a pharmacist. I'm still trying to kind of transition into the longevity. Well, I am a longevity distributor, but work is kind of in my way.
Yeah.
But I've started my cousin, who is a dialysis patient, on a regimen, and he's a diabetic. He's a type 2 diabetic. I've started him on Sweet Ease based on Dr. Wallach's recommendation. I started him on Ultimate Daily, 3 twice a day. I have him taking 2 Sweet Ease capsules with each meal. I have him on 2 bottles of plant-derived minerals, and unfortunately, his phosphorus has been going up, which I know is bad for dialysis patients. He's 326 pounds. He's 42 years old, and I thought that I was doing the right thing by recommending the Ultimate Daily, because I thought that's used to improve the circulation in the kidneys. But I don't want. His limit, on dialysis for his phosphorus is 5, and yesterday it was 7.1. No, 2 days ago it was 7.1. So I don't want to get him into any trouble. So what could I do? Well,
so when you're assuming that it's the nutritional supplement that's making the phosphorus levels increase, right?
Well, I know that there's phosphate in the Ultimate Daily, and that was pretty stable before he started these supplements. Mm-hmm. Well, it was stable. His protein is up, his phosphorus is up. Protein being up is good, but the phosphorus being up, I know is bad.
Well, it's not really bad. The MDs will tell you it's bad and they'll also tell you that when potassium levels increase, that's also bad too. But they really don't. They have a kind of a backwards understanding about these things. The problem with all of this is that the body has needs for phosphorus. It has needs for calcium. And because the kidneys are not working properly, a lot of stuff is leaking out into the blood. or not getting metabolized quickly enough. Now, I'm not exactly sure what the prohibition for dialysis with a heightened phosphorus level is. I don't know why that would be a problem. That's kind of outside of my domain. But so this specifically is a question for Dr. Wallach, okay? Because Dr. Wallach has way more experience in the active management of people on dialysis than I do. So, yeah, I can't imagine that this is going to be a prohibitive thing or it's going to be a bad thing. I think that the MDs have just kind of all agreed that phosphorus levels at a certain amount are problematic, and they're not really. But more to the point, so I would encourage you to call Doc on his radio show, right, and ask him specifically that question. But for everything else, if you're doing everything correctly, this guy should be losing 1, 2, 3 pounds a week, number one. And number two, his blood sugars should be coming down slowly. Now, at 300 pounds, 6 sweeties a day just isn't going to cut it. You got to give this guy 12 sweeties a day minimum. It's got to be 4, 4, and 4. And the sweeties is most effective between meals. And stick with me. When we come back from the hard break, I'll tell you why that's a problem and also give you a little bit of insight into how to dial this in more appropriately. Thanks a lot, Shauna. Stick around. Welcome back, everybody. The website to visit is fireyourmdnow.com. That's fireyourmdnow.com. And if you would like to schedule an appointment with me to have a personal consultation, which I do with people all around the world, 5 days a week, brand new website there. It's called Hire Your ND Now. How about that? We've got Fire Your MD Now, Fire Your Medical Doctor Now, Fire Your MD Now, and Hire Your ND Now. Isn't that clever? Shout out to Ashley James and Duffy in Seattle for coming up with those URL addresses. It's all about the teamwork, folks. We got to hang together, or as Benjamin Franklin said, we most assuredly will hang alone. Now, we're talking to Chandra about a person that she's helping who has a weight issue, a blood sugar issue, and a kidney dialysis issue. Chandra, are you still there?
I am.
All right, good. So, now look, when we're on board with a medical nutrition program, it's never everything that gets better all at once. It's always one thing and then the next and then the next. It's kind of like watching a flower grow, right? First a little shoot comes out of the ground, and then it gets a little bigger, and then it pops out leaves, and then it pops out a blossom, and then it pops out fruit. And it's all done in a stepwise fashion. One of the first things that you see happen with people that are on a correct program is they're losing weight. So is this guy losing any weight at all?
Said it's a slow process, but I have not been in touch with him every day. Like I said, I'm in Memphis and he's in North Carolina, which is home for me. But he said it's a slow process, but I don't really know. I've given him the recommendations about what to cut out of his diet, but I don't know how closely he's following that.
Well, all right. So yeah, this is probably the root cause of everything, right? Because what we are attempting to do here is support and promote his body's ability to fix itself. And so how do we do that? Well, we fill his nutritional tank up to the brim every day, giving him all of the stuff his body needs in order to sort itself out. But if he's doing that and he's continuing to eat the 10 bad foods, a little bit here, a little bit there, every time he eats those foods, it's like punching a hole in the bottom of that nutritional tank, and the nutrients are going to leak out before they get into the blood, and so he's going to be getting not a lot of traction from the nutritional program. So the first thing that I would do with this guy is I would increase the sweeties. I'd give him 12 sweeties a day. I'd give it to him between meals. I would give him all of the mineral supplements between meals, or if he can't handle taking the supplements on an empty stomach or between meals, then counsel him to do a Google search for foods that are high in phytates. That's P-H-Y, T like Thomas, A, T like Thomas, E, phytates. Phytates are found in spinach, they're found in beans, they're found in legumes, they're found in soy, they're found in certain nuts. So have him figure out, get a running list of foods that are high in phytates, and it's okay to eat those foods. just have him not take any of the mineral supplements with a meal that's high in phytates. Because if he does, the phytates will bind to the minerals that are in the supplement and disallow them from being absorbed. So that could be another problem. He could be like chowing down on rice, taking all of his sweeties with a big rice meal, or beans, or he could be eating spinach like nobody's business, or mixed salted nuts and doesn't know any better, and he's tossing back the minerals at the same time, and so they're not really going to be being absorbed into his body. The only time that medical nutrition does not work is if the person is not taking the right stuff, or they're not taking enough of the right stuff, or, to complicate things one step further, if they're simply not absorbing what they're taking. So in order to kind of cut the absorption problem off at the knees, we have everybody really dial in that diet. Call this guy up and enforce upon him the importance of eliminating those 10 bad foods. Up the ante with the sweeties. Call Dr. Wallach and ask him about that phosphorus question, because that is a little bit outside of my wheelhouse. If you can't get through to him, I'll get through to him myself, and I'll get that question answered, and I'll have it on air for you tomorrow. Ladies and gentlemen, I'm Dr. Peter Glidden. Check me out, please, 24/7, fireyourmdnow.com, or hireyourndnow.com. Life is good. From the proper perspective, everything makes sense, ladies and gentlemen. Take the Healthy Start Pack. Take your selenium. Eliminate the 10 bad foods and increase your consumption of antioxidants. Live long and prosper. I'm Dr. Peter Glidden. I'll see you tomorrow.